I just always wanted to be a nurse. I came from 5 kids. We had a lot of kids in our family, and Charity School of Nursing in New Orleans. We were Catholics, and they had a program where you could go to school for $600 a year, and my parents jumped on that. And I always wanted to be a nurse. I started out in alcohol and drug treatment unit at University Hospital. I was there for probably 2 years, and then I went to the operating room. Stayed there a long time, inpatient and outpatient. And then I went to hospice and worked for about 8 years in hospice, which led me here. We had a lot of patients who were dying from drug addiction, a lot from alcoholism, and I decided I wanted to see them get better instead of taking care of them when they were dying. Well, there's no, it's like night and day. It's just taking a black and white picture and then taking a color picture. How much difference 2 weeks makes in a patient's recovery. They're clear-headed. You can hardly talk to them when you're trying to do an admission because they're all over the place. Some of them are intoxicated or under the influence, and you keep asking the same questions every day, seeing if you're going to get a different answer, and find out where the truth falls. So it is, because they don't look even the same 2 weeks later. I have a child in recovery. She just celebrated 5 years of recovery, so it's very near and dear to me. Learning how to live, living through the addiction, and then how to reform families and alliances and regaining honesty and watching the family grow again. I was very fortunate to work with a group of men who were years ahead of their time in addiction medicine. Even at University Hospital, we were treating people it was a disease process. They knew that. There may not have been all the research there, or people going after the research piece of it, but they knew it was a disease. It was just, to them, they treated it just like diabetes. They treated it like any cancer. Even the hospice doctors I worked with did the same thing. It was amazing when you get people who understand addiction and that process. You're very fortunate. That's why I was so happy when the Bluff opened up. We've had nothing in this area for many, many years to compare with what's going on here right now. I believe that addiction is something that's so easy. People are ashamed. People are ashamed to come forward. They're ashamed to approach their employers, and there's so much fear involved in it, of the exposure for the family, for your children. This model is educating people through family sessions, individual sessions, of teaching people that it is truly a disease process, and it's a lifelong disease process that's never going to go away. It has to be managed, and it's teaching people how to manage their disease. I've never worked with as many people in recovery as I have here. They understand the process. They understand the heartache and the emotional piece of it. They've taught the people who aren't in recovery, but everybody has a tie to a recovery here. Well, it's incredibly wonderful having a medical director who's so involved, that you see every day. And being tied to GRU is phenomenal, because he comes and brings along his residents or his fellows, and they're here every day. They may see 5-6 patients every day, and it's not for 15-minute checkups. It's 30 minutes and 45 minutes. It's truly trying to figure out the medical regimen and what's going to help the patient move through, because a lot of them have dual diagnoses. They're just not suffering from addiction. A lot of them have bipolar disease or depression. So the two pieces of the clinical and the medical together is working. The nurses are seasoned psychiatric nurses. They're all from this area and they've worked in the psychiatric field. It's like, I came from a strong OR background. So generally, everybody who's been at every hospital because they're switching it up. But everybody was so excited when the Bluff opened because everything else is institutionalized around here. It's a different type of nursing. There's more an emotional side to it. I think one of the first things they need to know is how just making the decision is like it takes that elephant out of the room. It takes the elephant off your shoulders. Knowing that somebody you love is safe instead of being in jail or dead on the highway is life-changing. Making the decision to get some treatment, knowing the choices they have to make coming in here, whether they're going to lose their job, lose their family, are they going to get to see their children again? Those are real concerns that you have to work through with patients. And just forming the emotional bond with them that they'll listen to you enough to say, maybe it's going to work, let's try, is the biggest hurdle about deciding to come here. If you could express to people the relief they're going to feel when they finally make the decision and how much better it feels, it's worth that piece.